The new COVID boosters will soon be arriving at local pharmacies and doctors' offices.
The CDC is recommending everyone aged 6 months and up get the updated vaccine. Dr. Frank McGeorge is here to answer some of the questions people are asking about these new shots. Doc.
Well, you know, Kim and Devin, here's the first question about these booster shots. What's the difference between this booster shot and other ones? Well, the updated formula protects against a newer variant called XBB.1.5. Now, while that variant is technically no longer the dominant one, the vaccine is expected to be a better match for the variants that are spreading now and will through the winter.
So how long will the protection last? Well, you will get a boost in protection about 2 weeks after getting the updated vaccine. That protection should last a few months. Protection against getting severely ill likely lasts far longer. The CDC says there's also growing evidence that the vaccine reduces the risk of developing long COVID. Who should definitely get the booster? Well, anyone at higher risk from COVID. That includes people aged 65 and up, pregnant women, and anyone who has a weakened immune system or other serious underlying health problems. CDC data shows most of those hospitalized for COVID this year did not receive the booster released last fall. Hospitalization rates were highest in seniors and babies under 6 months who are too young for the vaccine. If I didn't get the previous booster, can I still get one? Yes, this updated booster will take the place of the previous one. You can receive it as long as it's been at least 2 months since your last dose. If I'm not in a high-risk group, should I wait to get it? Experts disagree on this point. Ideally, you would want to have your highest protection when cases are highest in your community or when, for example, around the holidays when you might be traveling or gathering more. But it's difficult to time the COVID waves and you run the risk of getting sick before you get the booster. How much will the booster cost? Well, if you have insurance, the booster should be covered. The federal government will provide some free vaccines to those who are uninsured. Check vaccine.gov for locations once the shots start rolling out. The out-of-pocket price for the shots is between $120 to $129.
Now, it's also flu shot time, and many people wonder if they should get the booster at the same time as their flu shot. Now, it is safe and obviously convenient to get both in one visit, but you may have more arm soreness and achiness than if you got them separately.
Yeah.
So as we've reported, a lot of people have gotten COVID recently. We seem to have a spate of cases. So if you are one of them and you've had this recent infection, and we've pointed out that that's about as immune as you can get is once you've had it,
Exactly.
How long do you wait then to get the booster?
Well, so natural infection does actually provide a little boost to your immunity, so there's really no need to get it right away. In fact, experts say it's reasonable to wait 4 to 6 months before considering a booster if you've recently had COVID, especially if you are otherwise healthy. But if you are in a high-risk group, you should go ahead and get the booster shot for sure.
Yeah. Okay, thanks, Dr. McGeorge.